I don't think we've seen any specific information to say that this is a laboratory accident or release, at the same time, we don't know the exact origins of this virus. Of course, the hypothesis is it comes from a reservoir like bats. It's very likely to have involved another animal somewhere in between the zoonotic or animal to human transmission. So that question hasn't actually been answered fully as yet. So I think there's a lot of work, including genetic analysis and more collection of animal and other data. There is international constructs with OIE, WHO, and others just to try and get to the bottom of the sort of where that zoonotic transmission occurs. So I think the natural history of the evolution of this virus will may be found in the upcoming months, but sometimes you actually might not find that until many months later. The SARS virus was the same thing. You had to sort of trace back, do a lot of sort of analysis in order to come up with a hypothesis. So I'm not sure that this is something that will be, immediately obvious, but work is continuing on that front.
There will be time, obviously, and a lot of interest and importance to understand how this virus became prevalent in the human species. And I think those questions are being asked, rightfully so. Certainly, the research and scientist community is all over it and trying to understand where the virus originated from and how it's evolved and mutated since it's been present in humans. But for me, as the Minister of Health, and certainly as the Government of Canada, although those questions are important because they will help us prevent future outbreaks and understand what we can learn from this particular virus, what's even more important right now is to stay focused on Canadians' health and helping Canadians get through the outbreak that we're in now, how we flatten the curve together, and how we protect and strengthen the health and social fabric of our communities.